Hello and welcome to a brand new episode of Health 360. On the show today, we're telling you about Vidya Balan and how she's managed to lose so much fat with the help of an anti-inflammatory diet. What exactly is an anti-inflammatory diet and why is it becoming important for us to recognize and identify those food items that help in controlling or dealing with and tackling inflation in the body? Also on the show, we're telling you about the reasons why you aren't losing weight in spite of trying so hard. Also on the show, we're going to be telling you about a video around loose vaginas which has got the entire internet into a frenzy. Why is that video an advertisement of a pill to tighten vagina causing so much stir? That and much more up ahead on the show. I'm Sneha Mordani. An advertisement that has become viral on social media around a pill that can be used to tighten your vagina has sent netizens into a complete frenzy. People are angry about this sort of a promotion of a pill which is actually not backed by science. Doctors and medical experts are giving their opinions about how ads of this nature promoting an over-the-counter pill to tighten your vagina is dangerous. We delve deeper to find out what exactly is the problem of vaginal laxity and how can it be dealt with, and also about this furor that this advertisement has caused.
Do it right, keep it tight.
Do you think you heard that right? You did, unfortunately.
By 1 million women. And the best part, zero side effects.
A pill to tighten the vagina. Comparing vaginal laxity, a serious medical problem, to loose jeans and a loose bottle cap. Highly misappropriate and highly ill-informed is what experts say. This video, this advertisement promoting a pill to tighten the vagina has left the medical community bewildered. There is great amount of interest around sexual wellness and sexual health, but vaginal laxity and problems associated with this organ is not monkey business, is what experts say. Experts say that vaginal tightening pills may create a temporary tightening effect, but evidence-based alternatives are recommended instead.
There are many non-surgical methods, and they are mainly using energy-based devices. The surgical method is the most efficient because you can reduce the size, you can tighten as much as you want to. And it is effective because we remove that much of lining and make the vagina actually physically smaller. The non-surgical methods are usually mild and will give you some qualitative improvement. One thing which can happen is you can make it too tight. That can lead to painful intercourse and something which is called dyspareunia, and or there may be problems in healing. Like any surgical procedure, you can have infection, you can have the stitch line not healed, gape. Usually does not happen.
Vaginal changes can happen due to childbirth, aging, hormonal changes and lack of exercise. And such medicines and products, experts say, play on women's insecurities and actually end up doing more harm than anything else. Earlier I spoke with Dr. Tanaya Narendra, very popular as Dr. Cuterus on Instagram. She's often busted myths around reproductive and sexual health. Listen to what she's had to say about this particular video that went viral. This is not the first video. We know that the internet is full of misinformation about, vaginal tightening creams, lotions, and all of these things. How does one really clear the air about it? Just tell us how these things actually just don't work. For people watching the show and are curious to know what was this particular model really trying to sell, what is going on here, why are there so many products available online, do they actually work, these OTC drugs, do they actually work?
So I'm going to come back to my rubber band actually.
Right.
So if I expand this rubber band, it's elastic, it's going to come back to its normal shape. But if I keep it stretched for a very long time, then eventually, yes, it can develop some looseness. It can become, not as tight and as firm anymore. But if I put a cream on it, on this rubber band, do you think it's going to go back to being all elastic when the elastic fibers inside it are broken? That's not how it works. And that's what we need to understand, that just buying some random over-the-counter product over something that may actually be a medical issue is not just designed to fail, but it can also lead to long-term problems. Because what if you actually do have a weak pelvic floor? What if you're actually going through something like organ prolapse? So don't get fooled by these promises that claim to fix things with just one, quick trick, one-trick pony. That's not really how our bodies are designed to work. More often than not, what these products do is that they remove the natural lubrication that exists in your vagina. If you wash your face a lot, and you don't put moisturizer on it, you can feel tightness on your face.
Right.
This is exactly what these creams and lotions are intended to do. They remove the natural moisture, which can feel like it's tighter, but it's actually just demoisturizing you.
How many women would be facing this issue? Because a lot of women, I would understand and presume that many of them would not take medical help for it, isn't it?
So the important thing to understand is that not everybody is having a loose vagina.
Right.
What can happen is that you can have a weak pelvic floor. So the whole pelvis, it is, think of it like a basket. And how a basket has a floor, the pelvis also has a floor on which your organs rest. You can have weakness in the pelvic floor, especially after multiple deliveries. If you have practices that weaken your pelvic floor, but by and large, it's not something that happens to a very large number of people. It is a misconception because we don't understand how the vagina works.
Do tell our viewers about what are the kind of options available before people who genuinely face this health problem.
So if it is a genuine health problem, putting a cream is not going to solve it. Putting a pill down there is not going to solve it. What you would need is either laser therapies. There's two kinds of lasers you can get. You'll need to speak to a gynecologist or a functional gynecology or cosmetic gynecology specialist who can give you the right options depending on the degree of damage. If it's a mild amount of damage, then the laser therapy can help. If it is extensive damage, then you might actually need surgery to cut away the excess tissue, which can happen after a lot of aging or significant amount of childbirth-related trauma.
So are there non-surgical ways to fix this problem at all?
Yes, there are non-surgical ways for doing this, which are only limited to conditions where there's only a mild degree of damage, where you can use something like a laser. So there's two different kinds of lasers that are available, carbon-based lasers or radiofrequency-based lasers that can help. But again, it depends on the degree of the damage, and then only an expert is the right person to suggest a medical intervention to you depending on the degree of the problem you're facing. It's not something we can just buy over the counter and see, oh, I'll just use it and see how it works for me.
Thank you for joining in and sharing in your views with us on that very important topic that we are discussing today. Popular actor Vidya Balan has spoken about the fact that for years together she struggled to lose fat, and that she's been successful this time around by following an anti-inflammatory diet. So what exactly is an anti-inflammatory diet? Remember, there are foods that cause chronic inflammation in your body, and that's the reason why an anti-inflammatory diet, which helps you consume only those food items that do not cause inflammation but deal with inflammation, is extremely important. Functional medical health experts are now increasingly prescribing to an anti-inflammatory diet or an elimination diet. You don't know what that is? And this report is for you. From fat to fit, the extra flab gone. A visibly leaner Vidya Balan is set at getting into an anti-inflammatory diet. An elimination diet has helped her lose the fat and not intense workouts. The fact is, both are great. intense workouts, and choosing an anti-inflammatory diet. First of all, what is inflammation of the body? Well, there are two kinds, the kind we need and the kind we don't. Inflammation is part of the body's immune response to protect against infections and help heal injuries. When the body detects harmful stimuli like pathogens or irritants, it releases white blood cells and immune system proteins to target the area of concern. This leads to redness, swelling, pain, and warmth in the affected area. Typical signs of acute inflammation, which is generally short-lived and beneficial. The problematic one is chronic inflammation, which is prolonged and can result from various factors: unhealthy diet, stress, exposure to toxins, and even certain medical conditions. Now, unlike acute inflammation, chronic inflammation often occurs silently and may continue for months or years, gradually damaging the body and contributing to a range of health issues. So, why is an anti-inflammatory diet important, and what does it do?
Anti-inflammatory diet means diet which does not cause inflammation to your body. Most of the foods which cause reaction in your body that makes your body repel against any food, and it generates an antigen antibody response, is inflammatory diet. And without getting too scientific, I'll tell you examples of inflammatory foods are processed sugars, processed foods and sugars, and things which are not in their original form.
Chronic inflammation impacts weight management, like it did in the case of Vidya Balan. Inflammation affects the body's ability to process insulin, which gradually leads to insulin resistance. This may contribute to weight gain, particularly around the abdomen, as higher levels of sugar gets converted to fat, some of which even accumulate in the liver. Inflammation can disrupt the production of leptin, a hormone that regulates metabolism and appetite. Low leptin levels can slow down metabolism, fat burn, and weight loss. Inflammation can raise cortisol levels as well, the stress hormone that increases fat storage, which then are the foods that feed inflammation or lead to inflammation.
Sugar, processed foods, like whatever is not in their natural form, from the how it is grown to how it is put on your table, is what is processing means. So most of the foods that are used by us in daily life, these are not natural, and they're more in packets and processed. Even atta is a processed food, to be honest.
Alcohol and smoking, of course, are the culprits here, but the biggest one is processed foods, the real culprits. Consumption of these promote inflation, but there are lesser known suspects here as well, like dairy, for example.
Dairy is not something that you have to avoid always, but dairy can sometimes initiate a response in your body. You know how you become lactose intolerant and all. It's just non-natural to be lactose intolerant. You know, the body is actually protecting you against something. Dairy has some carcinogens which are very addictive by nature. So dairy is supposed to be avoided as much as possible.
There are a whole range of other food products that we could be consuming without realizing how it could be causing inflammation.
Cured meats, artificially, grown eggs, the milk which has been produced after giving oxytocin injections to the cows. Those are the things that are unnatural, and there's so much to eat otherwise. Why would you go for things that are so, industrialized and processed for your consumption?
Chronic systemic inflammation is a factor in diseases like obesity, metabolic syndrome, pre-diabetes, type 2 diabetes, heart disease, inflammatory bowel disease, including Crohn's disease, and ulcerative colitis, some forms of cancer as well, also arthritis and Alzheimer's disease. What is important to remember is that without physical activity, an anti-inflammatory diet won't help you cut down the flab. Exercise by itself releases anti-inflammatory compounds and helps you regulate your weight. I'm doing what it takes. I'm exercising regularly. I'm not even having sugar. I'm on a diet perpetually all the time. But I'm still not losing weight. Is that a thought that crosses your mind very, very frequently? This report is for you because it gives you an indication, an idea about what are the problems you could be facing, what is it that you're doing wrong that's preventing you from losing that extra flag.
Do you relate to this? Exhaustive workouts day after day. Intermittent fasting. Eating just right. No sugar. No junk. But still feel like the scales won't tip in your favor, won't show you what you want to see.
Disappointment once again. If this is how you feel, weighing yourself day after day, trying to get to your optimum weight, but feeling disappointed each time you check your weight like that, and you have to understand that weight loss has got a lot more to do with many other factors than just exercise and eating right. Of course, eating right and exercising is non-negotiable, but there are just so many reasons why you could not be losing weight. Too much cardio and not lifting weights. Is that you? Then you need to think about your weight losing strategy vis-a-vis physical activity, vis-a-vis physical exercise. Because this is going to lower your metabolism. If you're doing too much cardio and not lifting weights, it actually sends a message to your body that it needs to conserve energy. Hence, lowering metabolism, preventing your body from losing that extra fat, that extra weight.
Weight training is the solution. You can lose weight and build lean muscle by doing strength training in addition to your cardio. Muscles allow for more calorie burn. The other reason why you are not losing weight is because you are not allowing your body to recover. Skipping a recovery after workout won't help you reach your goals.
After doing weight training or strength training, it needs to repair your muscle fiber tissues which break down during the strength training, as well as it repairs your muscle soreness. It gives a time to heal your muscle soreness, as well as it is very good for your mental well-being also.
Sitting is the new smoking. It also interferes with your weight loss. Sitting for long periods may be the reason for weight gain or lack of weight loss. Research has found that your risk for obesity increases by 5% for every 2 hours of sitting. Stand when you can. Not changing your diet will prevent you from losing weight.
All your favorites should be included in moderation at intervals as a part of your sustainable diet. Portion control and frequency is the key. If you cannot manage these two and continue to eat as per your old eating habits, if you're not ready to be the change, you do not see a change. So unless you change something about your eating habits and your lifestyle, your health would go down the same trajectory.
Macronutrients are important. Cutting out an entire macronutrient from your daily diet like carbs, the body's primary energy source, can deprive your body and tempt you to binge instead.
Your diet should provide you with all the macronutrients. When you reduce your carb intake, it definitely helps you with weight loss, better sugar control, and better insulin response. But remember that carbohydrates break down to form glucose, which is a fuel for our system. And when you cut out your carb intake drastically, your body starts using protein to meet its energy requirement. Other side effects include fatigue, weakness, headache, poor exercise performance, bloating, constipation, risk of ketosis, hypoglycemia.
Not staying hydrated is also a reason why you could be gaining weight. It could suppress your appetite, boost your metabolism, and make exercise easier and more efficient. And not getting enough consistent sleep can lead to weight gain. Sleep deprivation can lead to obesity. And this is because the same hormones, namely ghrelin and leptin, that play a role in the sleep cycle, also affect your appetite.
We see that people who actually sleep for shorter duration tend to gain more weight. People who sleep for shorter duration tend to have higher levels of hunger hormone, which is ghrelin, and lower levels of satiety hormone, which is leptin. So when you have higher levels of hunger hormone, you will obviously feel more hungry. And if you have lower levels of satiety hormones, you may eat a lot, but you will not feel satiated. So you will tend to reach out for more food, and you will have more calories and still not feel satisfied.
Stress is a factor. The cortisol belly is for real. More stress, more visceral fat around your tummy.
We see people dealing today with a lot of stress. In fact, I think it is one of the most important factors, and stress is very, very important when it comes to obesity. Chronic levels of high stress lead to release of a hormone called as cortisol, and this cortisol actually creates a lot of havoc with our body. It can lead to increased hunger, it can lead to increased fat deposition, it can also lead to increased insulin resistance, and all these factors together can lead to weight gain.
Well, if you are on certain medications, you might not be able to lose weight as efficiently as you would want to if you are taking these medications. Now, examples here include beta blockers, corticosteroids, and insulin. Weight gain is a common side effect of other medications: antidepressants, anti-diabetics, antipsychotics, and anti-epileptics. Do not start or stop a medication without talking to your healthcare provider. Talk to a medical professional if you suspect that your prescriptions are affecting your weight.
Psychiatric medications are particularly notorious in causing weight gain. Certain classes like antipsychotic, antidepressant, and mood stabilizers are particularly more prone in causing weight gain as a side effect. Within these classes of molecules, certain molecules cause more weight gain than others. So certain drugs like mirtazapine, olanzapine, and quetiapine are known to cause weight gain, which is significantly more than other molecules.
Certain health conditions will stop you from losing weight fast. Cushing syndrome, a hormonal disorder that develops after long-term exposure to high levels of cortisol. Depression, diabetes, hypogonadism, which occurs if your gonads, sex glands, make little or no hormones. Hypothyroidism, menopause, polycystic ovary syndrome or PCOS, which happens if the ovaries or adrenal glands produce more androgens, which is male hormones, than usual.
Hypothyroidism would usually lead to very modest weight gain. So it may lead to a weight gain of say 5-8 kilos or maximum 10 kilos, but not more than that. Cushing syndrome, it's much more rare as compared to hypothyroidism. We don't see it as often. In this condition, we commonly see patients who come with weight gain and central obesity. Increasing weight gain actually leads to hypogonadism in adolescent boys and also young adults. So obesity actually leads to hypogonadism.
And lastly, a weight plateau. What happens when you hit it?
The usual cycle is that when a person starts on a program, whatever it is, they would actually lose rapidly in the first few days. So the graph is very steep. It comes down very fast in the first few days. Then the weight loss slows down, and then it kind of plateaus. And usually by the time it plateaus, the person tends to start getting demotivated. And then once you stop the program, after a few days, we see that the weight tends to creep back. So eventually the whole cycle has to begin again.
Hope this answers many of your questions around weight loss. Well, here are two more. Many people wonder, how can a person speed up their metabolism? Now, to facilitate weight loss, you can support your metabolism by doing these things: balanced diet, rest, exercise, and hydration. Also, if you feel and look thinner, but you are not really losing weight on the scales and also exercising, be rest assured, That could be the weight of the muscle mass, which is more compact and dense as compared to fat. So do not stress about that. Well, that brings us to the end of this edition of Health 360. We hope you enjoyed watching the show as much as we did, putting it together for you. We certainly hope you found it informative and important from the point of view of what changes you can make to improve your health and to improve your lifestyle. From the entire team of Health 360 and India Today, we're thanking you. Be safe, take very good care of yourself. Bye for now. Done.
बढ़िया, बहुत बढ़िया.